My name is Dr. Gwen Maxwell, and I'm a plastic surgeon in Tucson, Arizona. I've been practicing for about 20 years, specializing only in cosmetic procedures. Fat probably got popularized, or it was at least around 20, 30 years ago. However, some of the newer techniques that have been developed has revolutionized the way fat has been used. One of the true things that happens to the aging face is that volume is lost. And so you can't tighten the face enough to make it look natural or even beautiful without the restoration of volume. So the question then becomes, how, if you buy filler that's actually in a box, you end up with an astronomical price to the procedure. Your own fat is soft, natural, it's its own biograft. So you're taking it from one area and transplanting it, if you will, to another area, so it can actually become incorporated into the substrate of the soft tissues. Also, there's a large amount of it that's available. If you put it in a rich environment where it's surrounded by a blood supply, it will actually live as a permanent graft. We know that for certain, but we also know that fat is the richest source of something called a progenitor cell, a type of a connective tissue cell that can eventually form its own collagen. I tell my patients it's like fertilizer. You know, you're fertilizing, you're nourishing underneath the skin. Somehow you're interjecting those cells that are capable of forming more ground substance, the hyaluronic acid, the stuff that actually really plumps up the skin and nourishes it from underneath.